Hello, everybody. Ahmed Al Hashim is speaking, and my partner is Muhammad Hajirat. Today, we are going to talk about caregiving for older adults. This is just an overview of what we will be talking about today, starting with an introduction. We will be giving some definitions, epidemiology, and statistics. We will go over a recent study on caregiving, and we'll show you an interview that we did with an informal caregiver besides other videos. Going briefly over some ways to improve caregiving for older adults. Caregiving for older adults mainly entails looking after the aging population. These senior citizens can no longer look after themselves or provide for themselves with the basic human needs. Caregiving entails providing physical, emotional, social, and economic support to the elderly citizens. The extent or level of caregiving depends on a number of issues such as type of illness. Caring for someone with Alzheimer's disease, for example, or other brain impairing disorders can be more stressful than caring for someone with a physical impairment. Second factor is time. Some disorders like cognitive disorder can be 24/7 job. This is because these elderly people are slow and experience difficulties in executing certain tasks. Their brains are also at risk of disease effects, hence slow functioning. To boost the confidence of these people, it is important that they are assisted in doing simple tasks. Third factor is financial capacity and economic resources. For example, long-term caregiving has significant financial consequences for caregivers. Caregivers face the loss of income of the care recipient and loss of their own income if they reduce their work hours or leave their jobs. Persistence is another factor that should be exercised when giving care to the elderly. Some of the elderly tend to be stubborn in doing certain tasks that will help them in one way or another. There are various types of caregiving. These could be characterized in terms of physical, mental, long-term, short-term home caregiving, and hospitalized caregiving. Physical caregiving mainly entails giving physical assistance to the aged who either are incapacitated or cannot walk or do certain activities. Most of the elderly people who need physical care are restricted to wheelchairs. Physical caregiving may be bathing and feeding the elderly. Mental caregiving is also another type of caregiving. It involves the caregiver giving emotional and psychological support to the elderly. Such supports include providing companionship and initiating conversations that will help improve the patient's mental and psychological state. There is also the long-term type of caregiving, which involves providing care to the elderly who can no longer do basic human activities. Most of these people who need long-term care have chronic illnesses or condition that limits their ability to carry out basic human activities. Hospitalized caregiving entails providing care for the elderly from health institutions. These people require attention from highly specialized caregivers due to the complexity of their conditions. This falls under the aspect of the long-term, since these people can no longer perform basic human activities. They also suffer from chronic illnesses that inhibit their capacity to perform basic tasks. Caregivers are the people entrusted with the provision of care and the required attention towards the elderly people. As such, caregivers need to be people who exhibit qualities required to effectively dispense their duties. Caregivers could either be formal or informal. Informal caregivers are the people closely related to the person they are taking care of. This could be a family member, neighbor, or friend. They provide assistance to the adults and could either be living with the patient or separately. Formal caregivers, on the other hand, are the people who are paid to provide these services, or they could also be volunteers. These could be either from a government or non-governmental organization. As we mentioned, caregivers perform a number of roles in their day-to-day provision of services to cater the needs of the elderly. These roles include performing errands for the elderly, preparing meals, direct nursing to the elderly, such as administering medication, ensuring personal and environmental hygiene, and guiding or assisting the elderly to perform specific activities, such as taking them for a walk. There are many caregivers' characteristics. Empathy is considered as a characteristic that is observed when dealing with the elderly. This is trying to understand what these people are going through, being able to recognize and understand what they feel and go through forms the basis of how they need to be treated and served. Caregiving also entails being intuitive, which is getting to know what really affects them and how they respond to specific actions. This is important as one can know what to do in specific situations involving these people. Another characteristics includes commitment, good judgment, and creativity. The video caregiver assistance Spoon TV commercial makes people realize that aging is a normal process, and just as children need the support of their parents, elderly need the support of younger generations. We are all dependent on each other, and aging is a process that we inevitable experience. The video talks about role change, which I think most of people agree with. Caring for an older patient needs physical and emotional skills. Support and training will better equip the families that are taking care of elderly with a chronic health problem. The video rightly tells that everyone will be a caregiver and in need of a caregiver at some point in their life. Canada has carried out a number of surveys and research on the issue of caregiving among its population. The statistics that have emerged as a result of these research point out various factors with regards to the issue of caregiving. Some of these statistics are the General Social Survey conducted Canada's first statistical research in 1996 aimed at determining the level of care provision among the Canadians. According to the data collected, it was established that a considerable population of Canada was willing to provide care to those who experienced health problems or the aged. The second time the research was conducted in 2002 was merely to look at the care given to the aged population. It was identified that despite other commitments such as work, family members and friends were still willing to take care of the elderly. In 2007, according to the research, the age of the caregivers ranged between age of 45 and 64. The majority of these caregivers were women. In 2012, 28% of the Canadian population were caregivers aged 15 and above. These people provided health care to the disabled family members and those who were aging. According to the statistics, the amount of caregiving relied on the level of relationship between the caregiver and the recipient. In comparison to the United States, which has seen a majority of its population giving care to about 43.5 million, most of these are unpaid caregivers. 16% of Canada's caregivers also reported having given care to a family member or a neighbor compared to 15% of the Americans. Another difference is that 19% of the caregivers in Canada compared to the 7% of Americans had provided care to their parent-in-laws and other family members. Finally, 13% of Canadian caregivers had given care to their grandparents compared to 7% of the Americans. In 2012, age-related needs were identified as the single most common problem requiring help from caregivers, 28%. This was followed by cancer, 11%, cardiovascular disease, 9%, mental illness, 7%, and Alzheimer's disease and dementia, 6%. However, the overall picture differed somewhat for caregivers of spouses and children. Cancer was the leading reason behind spousal caregiving, 17%, while problems with mental health, such as depression and bipolar disorder, were the most common reasons for parents caring for a sick child.
One of the studies on the caregiver for adults was the examination of family caregiver experiences during care transitions of older adults conducted in 2014. The authors were Justin Jusa and Paul Stolley. This study aimed at exploring the experiences of family caregivers in supporting care transitions between the hospital and home for older adults with medical complications. The study used the method of qualitative grounded theory approach to explore the experiences of family caregivers during care transitions from hospital to home. Study method occurred in 3 phases. Phase 1 consisted of engaging case managers from one of 14 Community Care Access Centers (CCAC) located in Ontario. The method entailed the inclusion of resource case managers in order to explore their perspectives of transitional care experiences and family caregiver participation during the hospital-to-home transition. Phase 2 consisted of engaging informal caregivers who were providing support to older patients with hip fracture and stroke. Semi-structured interviews were to be carried out during this phase in order to explore the transitional care experiences of those informal family caregivers. Phase 3 involved member check sessions. Specific attention was to be given to the different responses from the caregivers, patients, and family doctors. The theory of caregiver support needs during care transitions from hospital to home has 6 characteristics that were expected of the caregivers in order to successfully carry out their roles were practical information and education, unique family situations, involvement in the planning process, agreement between the formal and informal caregivers, time to make arrangements for other personal issues, emotional preparedness, medical crisis and admission to hospital. Caregivers describe their feeling of limited and stressful time. There is no adequate time to adapt the relationship with the elderly. Acute care. They found that families required an educated caregiver. Home. They found that there was lack of caregivers' confidence. One of the study limitations in developing such theory of caregiver needs to support a successful care transition from hospital to home is the inclusion of one type of health professionals. As mentioned, only community and source case manager was included in samples. Therefore, not all the information given is reliable and it's difficult to tell whether there is bias in information towards community case needs rather than hospital care needs.
Hello everybody, we would like to welcome our lovely neighbor Annie. She has been providing care to her mom in home for a while. So could you share with us how long have you been providing care to your mom?
Approximately 10 years. Well, if you have power of attorney, then you are responsible for everything that involves that person. If it's your mom, your dad, whoever. Right down to bathing, making sure their skin is in good care, that there are no issues anywhere, and you just have to be very careful that everything is the way it should be in every way. From my mother, by this time she was in her 90s, her back was very bad. The doctors expected her to still come out, and if I had an appointment, she had to go. There were no doctors to come here and visit her. She could hardly get ready. It was very difficult for her and difficult for me. And sometimes she would get upset and she didn't want to go. But like I said to my mom, I am responsible for you in every way. If you have an appointment, we have to go. Sometimes I'd be upset because I would think, why can't they have a doctor for the elderly? I asked the doctor that. She said, well, we just don't. And I'm thinking, in this day and age, surely. I mean, why do the elderly have to suffer like that? Like, there should be some kind of recommendation there that the elderly should be looked after in their homes if this is what they truly want. So I would take my mother to the appointment, bring her back, and she would be absolutely exhausted. And she would say, I'm never going again because it's too much. You try to put yourself in their position. You're in your 90s. It's too hard, right? And challenges also, like sometimes Mom would fall, as you know. Ahmed, you and Marwa came over to help me. On several occasions, Mom fell, and I called the ambulance because I could not get her up. So I was always worrying about what was going to happen next. And my mother did not like to bathe. I was bathing her in the shower. That was a challenge. Then it got to the point where I couldn't do that because she didn't want it anymore. So I would wash her on the chair, from the top to the bottom, but change the water in between. And Mom would get very angry with me. She said, oh, not today, I'm too tired. I said, Mom, if something happens to you and I don't wash you at least once a week, they're going to blame me. They're going to say, why didn't you bathe your mother? Oh, well, she didn't want it. It can't happen. When you are power of attorney, you are looking after that person. You have to look after them to the very best of your ability. This is your mom. This is your dad. This is your aunt. Whoever. Okay? So there are many, many challenges. No, there is not. The problem with that is the government wants to keep people in their own homes. And that's fine. And the resources are supposed to be out there in the community. But as far as I'm concerned, knowing what I know after looking after my mother, there are very little resources out there. And they say, oh yes, you can tap into this, into that. There's nothing. CCAC would come every 6 months to see how Mom was doing, and we would talk. I would look after her. Sometimes my mother would break down and get sores on her buttocks. I looked after that because I was in nursing. But had I not known how to, they would send someone to do that. But that's about all the help you get. Emotionally, there's no help for the caregiver. There are not enough resources. I mean, people used to be in the hospital years ago when they got to that point. Now, fine, keep the person in the home, but then give people something to work with. Send doctors, send whatever they need. Whether it's to fix their teeth, their hearing, they won't come to the house. They expect you to go there. So the resources are, as far as I'm concerned, non-existent. Very few and far between. I think CPR is a good idea for everyone to know because, something happens, then you can start the CPR and then you call 911. I mean, otherwise you feel helpless and you don't know what to do and you get panicky, right? So I think CPR is a very good thing for everyone to know. The main way to improve caregiving I think that goes back to what I was saying. Have more people available in the community to help the caregiver and the person getting the care. Do you know what I mean? Like, okay, I know you can get people in, they'll give you maybe 4 hours, so you can get the person bathed and maybe they can help you change the bed and that sort of thing. But that's not always easy either. You need to have there needs to be a different type of program set up if they really, really, really want to help the elderly. And people should say, okay, we'll come to see you maybe every other day for 2 hours. And we'll give you the care, whatever you need. But that doesn't happen. You have to get on the phone, you have to try and find someone. Do you think you could come and bathe my mother? Oh, not today, 2 days from now. So what do I do in the meantime? I guess I'm going to do it on my own. And so there are many gaps in the system. So I really don't know what the answer is, but they need more help for the caregivers and also for the elderly person. Like, fine, come and put the dressings on. And then, you know, like there's got to be more to it than that. What if you need to lift your parent or whoever you're looking after out of the bed? Who's going to help you with that? Most of the time, no one. It's very difficult, and everything in life sounds good. There's a lot of talk, but very little action.
Caregiving and caregivers generally encounter a number of problems. There is a lack of support both in terms of finance and psychology from relevant government organs. Caregivers also experience stress and reduced amount of time for personal commitment. Other challenges, including but not limited to health concerns. These could be fatigue, sleep problems, risk of illness, injury, and mortality. Care decisions such as when it's time for various services, residential placement, and end-of-life care planning. Moreover, resources and eligibility for services. These could be housing, healthcare, and community services.
Through a number of programs and policies, the Canadian government has embarked on a series of initiatives to help its aging population. This is so as to maintain active engagement in the community and maintain the active lifestyle. The Canadian government in the year 2006 established the Office of the Minister of State Seniors within the Employment and Social Development Canada. This office had the mandate to work with ministers and other government stakeholders to ensure that the development of policies and programs that affect Canada's older adults. One of the programs was the Old Age Security, which ensures that these people are accorded financial benefits such as the Old Age Security Pension Plan and the Guaranteed Income Supplement, GIS. GIS is an additional monthly benefit targeted to old age security recipients who have a low income and reside in Canada. 1/3 of Canadian seniors who receive the OAS pension also receive the GIS. There is also the New Horizons for Seniors program established in 2004. This program aids seniors in Canada to benefit and contribute to a quality lifestyle. It engages seniors in events such as social participation and awareness of elder abuse. The Assisted Living program by the Public Health Agency of Canada also serves to address the challenges the elderly living on the reserve. It helps in the provision of funding social and medical support for senior people. Enactment of good government policies can also contribute to helping older adults in Canada. Such policies include the government increasing the health transfer payments to provinces in support for the elderly. The National Seniors Councils under the Canadian government formed the policy retaining older workers while attracting older ones. There is also the tax major policy in Canada introduced in the year 2005, which allows seniors to pay lower taxes. Caregivers should also be supported, such as implementation of direct aid to caregiver family members through the family caregiver tax credit. The U.S. Department of Health and Human Services established the National Family Caregiver Support Program of 2000 in order to provide different services such as providing information to caregivers about services, helping caregivers to access these services, providing caregiver training and counseling. Moreover, the U.S. introduced the Family and Medical Leave Act of 1993, which provides job protection to employers who need short-term leaves from their jobs in order to take care of their parents or children. Advocacy programs also contribute to the improvement of caregiving. Such advocacy programs include the Health Insurance Counseling and Advocacy Program in California, which provides personalized counseling and community education on healthcare. It's the main source of information regarding medical benefits and health plans.
Over 30 Alexian Brothers Pace vans roll out each weekday morning. They are headed to every corner of Hamilton County to pick up older adults at their homes. The transportation that Pace provides is vital to participants and their families.
We are personal chauffeurs for all of our participants, and we give hands-on assistance from door to door.
Transportation to the day center is not the only function of Pace vans. Drivers transport participants to off-campus medical appointments, including dialysis. They also deliver medications, dietary supplements, and disposable briefs to the homes of those who need them. Although transportation is widely recognized as one of the most pressing needs of the senior population, our fleet of vans and drivers make the Pace model of care possible and accessible.
The drivers perform so many functions. They connect the day center and the home, and they make the ride between them enjoyable. Part of the fun of coming to Pace is getting out of the house and seeing what is going on in the community.
In this video, Transportation for Older Adults at Alexian Brothers PACE, the driver talks about the services they offer. They transport participants to daycare centers, to places of medical appointments, and for dialysis. Alexian Brothers also delivers medications, dietary supplements, and disposable briefs to the homes of its participating members. Communities can form partnership with transportation service providers. Such partnership will benefit the elderly population in the community and improve their quality of life. The video rightly addresses the problems related to mobility of the elder population. Aging can affect cognitive skills and vision, thus making driving by oneself difficult. The aging population will need assistance with transportation for their specific needs. Only a few of the transportation needs were described in the video. Some may need special arrangements and help of a paramedic while traveling. This part of the transport was not adequately covered in the video. Better coordination between the community and transportation services will ensure that all elderly in the given locality benefit from such programs. The effort taken by Alexian Brothers is innovative and helps to improve the quality as well as accessibility of care. Creating a better network will help the transportation services to reach out to the elderly in different locations.
In summary, caregiving is providing care for the physical and emotional needs of a family member or a friend at home. There are many types of caregiving such as physical, mental, long-term, short-term, home care, and hospitalized caregiving. Caregivers consists of formal and informal caregivers. The issue of aging and provision of care to the elderly has been one of the challenges facing various economies and societies around the world. The growth and surge in the number of the aging population have been as a result of a longer lifespan and better health services. Chronic diseases, however, have been the leading causes of death among the older adults. Adequate and more effective measures should be put in place to ensure that older adults are well taken care of. The caregivers should also be supported in terms of ease of access to medical services and financial support.
I could make a wish, and my wish would be that we could start old and go back to being very young. That would be awesome. And even my mother said that. So rather than getting old, you go from old to young, and then you go back to God's arms. Amen. Amen.